Okay, so we have made it down to the level of the lungs. Now, there's an asymmetry to our lungs because of the presence of the heart on the left side of the thoracic cavity. So the right side lung has three lobes, the superior, middle, and inferior lobe, whereas the left side lung only has two. It has a superior lobe and an inferior lobe. Now, just as an aside, these lobes are very important in that allows, if someone has lung cancer or some kind of a condition, you can remove a lobe and still have functioning lungs. So they actually, it's a good thing that we have these. So anyway, as we have these lungs, and inside the lungs, we had said we have the bronchi, which then start branching into bronchioles. And so bronchi are big, and then bronchioles, and then the bronchioles get smaller and smaller. And so they start branching off. These are cartilaginous. So remember we had said, we got a cartilage-containing larynx, we've got a cartilage-containing trachea, we've got bronchi, and we've got bronchioles. And so as these bronchioles are branching, we have primary, secondary, and tertiary. So as they branch, they become smaller and smaller, and we change the name to from primary to secondary to tertiary. And these all contain cartilage. Now, how did we say gas exchange occurs? We said it's by simple diffusion. And that's movement from an area of high concentration to low concentration. This does not occur through cartilage. Cartilage is too dense. Gas exchange does not occur through that. So we have to keep on going. Eventually, as we keep branching, we get to the level where we have quaternary bronchioles. These are also known as respiratory bronchioles. They do not contain cartilage, and this is part of where gas exchange occurs. The respiratory bronchioles open up into little air sacs called alveoli. And you have an enormous number of alveoli. The surface area in your lungs, so if you think of your lungs and the amount of surface area in there, it's roughly equivalent to the surface area of a tennis court. So you have a huge amount of surface area in your lungs because it's all divided up into these little teensy tiny air pockets called alveoli, and this is where gas exchange is going to occur. And so we have capillaries that are in here that are associated with the quaternary bronchioles and the alveoli, and they're laying right on the surface. So if you look at make sure you look at slide number 6 in your packet, and you can see that we have capillaries wrapped around these. And so, yeah, so I'm just looking at my notes here, and it says you have 300 million alveoli, and they have a surface area of 70 to 80 square meters. That's enormous. And so when we talk about the respiratory tree, we're going to talk about how we have the respiratory portion and the non-respiratory portions of the tree. And so the bronchi, the trachea, the bronchi, and the bronchioles, primary, secondary, and tertiary, are non-respiratory, whereas then when we come to the respiratory portion, it's going to be the quaternary bronchioles and the alveoli, and this is where external respiration is going to occur.